Vitamin B12 is a crucial nutrient that plays a vital role in maintaining our overall health, yet it's one that too often gets overlooked. As we age, our bodies naturally become less efficient at absorbing this essential vitamin, making it even more important to pay attention to our intake and ensure we're getting enough. Unlike some nutrients that our bodies can produce on their own, vitamin B12 must be obtained from external sources, specifically supplements or animal-based foods. Despite its importance, many people don't take vitamin B12 seriously, which can lead to a host of health problems that are entirely preventable. Surprisingly, statistics suggest that up to 40% of people in North America may be experiencing some level of vitamin B12 deficiency. This issue is particularly common among individuals who suffer from chronic fatigue syndrome or fibromyalgia, but it can affect anyone. The symptoms can be subtle at first, but over time, a deficiency can have a profound impact on your quality of life. So, what are the signs of vitamin B12 deficiency that you should never ignore? Understanding these warning signals is the first step to protecting your health and ensuring your body has the nutrients it needs to function optimally. The first and perhaps most telling sign of vitamin B12 deficiency is persistent fatigue. This isn't the kind of tiredness that comes from staying up too late or having a busy week. It's a deep, unrelenting exhaustion that lingers even after you've had a full night's sleep. If you routinely get 7 to 8 hours of rest but still wake up feeling drained, your body may be struggling to produce enough red blood cells. Vitamin B12 is essential for red blood cell production, and without enough of it, your cells can't transport oxygen efficiently. The result is a constant feeling of tiredness and lack of energy that doesn't improve no matter how much you sleep. Another sign to watch for is muscle weakness. Your muscles rely on a steady supply of oxygen to function at their best, and that oxygen is delivered by red blood cells circulating throughout your body. When there aren't enough healthy red blood cells due to a vitamin B12 deficiency, your muscles may feel weak or lack the stamina they once had. Everyday tasks might suddenly feel more strenuous, and you could find yourself struggling to carry groceries or climb stairs, even if you were able to do so easily before. Vision problems can also indicate a severe vitamin B12 deficiency. In extreme cases, a lack of this vitamin can damage the optic nerve, which is responsible for transmitting visual information from your eyes to your brain. It can also cause blockages in the blood vessels of the retina, leading to symptoms such as double vision, blurred vision, or even vision loss. If you notice any sudden changes in your eyesight, it's important not to ignore them. While there are many possible causes of vision problems, vitamin B12 deficiency is one that should be ruled out by a healthcare professional. Pale or yellowish skin is another potential warning sign. When your body lacks sufficient vitamin B12, it can lead to the breakdown of red blood cells, releasing a substance called bilirubin. This buildup of bilirubin can give your skin a yellowish tint, a condition known as jaundice. If you notice a change in your complexion, especially if it's accompanied by other symptoms like fatigue or weakness, it's a good idea to consult your doctor. Your tongue can also offer clues to your vitamin B12 status. The tongue is covered in small bumps called papilla, many of which contain taste buds. People with B12 deficiency may lose these papillae, particularly from the back of the tongue, making the surface look smooth and red. This change can cause discomfort, pain, and even alter your sense of taste, making foods seem less flavorful or enjoyable. If you notice your tongue feels sore or looks different, it could be another sign that your body is lacking vitamin B12. But what causes vitamin B12 deficiency in the first place? Several factors can contribute to this problem. One common cause is an imbalance of gut bacteria. Our digestive system contains beneficial bacteria that help break down food and absorb nutrients, including vitamin B12. When the balance of these bacteria is disrupted, whether by illness, antibiotics, or other factors, it can impair the absorption of this vital nutrient. Another cause is medical treatment, such as chemotherapy. Some medications used in chemotherapy can inflame and irritate the lining of the gut, making it more difficult for the body to absorb vitamin B12 from food or supplements. So, What steps can you take to address and prevent vitamin B12 deficiency? The first and most important step is to evaluate your diet. Vitamin B12 is found naturally in animal-based foods, such as fish, chicken, and lamb. Organ meats like beef liver and chicken liver are especially rich sources. If you eat a plant-based diet or have dietary restrictions that limit your intake of these foods, you may need to be especially vigilant about getting enough vitamin B12 from other sources. For those who can't or prefer not to consume animal products, or for anyone who struggles to absorb vitamin B12 efficiently, supplements are an excellent option. The two most common forms of vitamin B12 supplements are methylcobalamin and cyanocobalamin. These are widely available over the counter, but it's always best to consult with your doctor before starting any new supplement. Your healthcare provider can help you determine the right dosage and ensure that the supplement won't interact with any medications you're taking. In addition to dietary changes and supplements, supporting your digestive health is vital. Probiotics, beneficial bacteria that support a healthy gut environment, can enhance your body's ability to absorb vitamin B12 and other nutrients. Fermented foods like kefir, dark chocolate, and kombucha are excellent natural sources of probiotics and can be easily incorporated into your daily routine. Finally, it's important to minimize your intake of inflammatory foods, which can impair gut health and hinder nutrient absorption. Packaged foods, fast food, fried foods, low-quality meats, and foods with artificial additives should be limited as much as possible. Instead, focus on whole, nutrient-dense foods that support overall wellness. By recognizing the signs of vitamin B12 deficiency and taking proactive steps to address it, you can protect your health and ensure your body has the nutrients it needs to thrive. If you experience any of the symptoms discussed, persistent fatigue, muscle weakness, vision changes, yellowish skin, or changes to your tongue, don't hesitate to consult your doctor. Early intervention can prevent serious complications and help you feel your best every day. What's your favorite health-boosting food? Comment below and subscribe to Health Also for more vitalizing health tips.